Liz, could you start off by telling us how your health issue was first discovered?
Yes, I went to the GP with a strange pain in my side, and I was referred for a scan. The scan revealed that the pain in my side was something very minor, but having the scan they could see a thickening in my cecum, which then he wanted to follow up straight away. This was just before Christmas, and he was very non-committal. This could be benign, but it could also possibly be not. I was concerned because my mum had a tumour in the same place. She was older, but she did die of bowel cancer and the resulting secondaries. So it was a bit nerve-wracking.
And Jim, what was your reaction to hearing that news that something might be wrong?
Well, obviously concerned, but also relieved in the sense that it was found early, so we could do something about it.
Liz, what was your initial diagnosis and what were you told about your options?
It was to firstly have a biopsy to see if it was benign or cancerous, so that was the first hurdle, and then it would be resection surgery, probably whichever way it would go, because it seemed to be fair size, the lesion I had. So that's what I was told, and obviously if it was a cancerous one it would be further treatment and further whole body scans, etc. So that was how it was left, and waiting for news of biopsy in the new year. So that was how we were left that day.
And how did you feel after hearing that news that surgery might be a potential option?
It was, like anything, it was a bit of a shock, because it was the good news first. All the pain you're having is something very minor, and it's a tiny stone in your bile duct, and it'll go away. But we've found this, and obviously nobody can tell you at that moment in time whether it's benign or not. So you're obviously left a little bit worried, and then the wait for the next colonoscopy and biopsy, and then the surgery afterwards. So it seemed at that moment to be quite a long process.
Jim, you then were aware of the Speedboat procedure, and you mentioned that to Liz. How did that progress?
Yes, obviously I was software development director at Creo before I retired, so I was fully aware of Speedboat and its capabilities, and immediately thought that it would be an option for treating the lesions. So made a few inquiries in Creo and contacted the most experienced surgeon in terms of using the Speedboat, Dr. Zach Tsiamoulos, who's based down in Kent. So got in touch with him and arranged a telephone conversation with him and with Liz.
Okay. And after that initial consultation, what sort of helped you make the decision that this was the right treatment for you?
Well, we spoke to Zach almost straight away, and I knew a little bit about the procedure from Jim, because he used to talk excitedly about it when he worked here. And Zach said, I'll have a look as soon as I can, which was New Year's Eve, which was really good, very, very quickly. And then he could do this procedure, and it would be 1 or 2 days, and I would be absolutely fine. So this sounded an excellent option to me. As I say, I knew a little bit about the device, but Zach was very confident, very reassuring. So I made up my mind straight away. If he can do it, that's all we're going to do.
Was there an option of having Speedboat locally to you at that time, or was it that you'd have to travel to see Zach?
I would have to travel. We did mention it to the original consultant, and who'd heard vaguely about it, but he didn't really know enough to say where I'd have to go or anything further. He just said, no, we'll wait for a biopsy and make a decision then. I've got a nice team of surgeons who will be waiting for you, basically. And obviously that would involve a lot more hospital time, a lot more recovery time. We're pretty busy with grandchildren, etc. And the thought of non-invasive, very quick treatment, especially with somebody like Zach, just bring it on.
And if I can take you back to the day of the procedure itself, how did you feel going into what you had ahead?
I was just relieved to be there and just wanted it to be done. Obviously I hadn't had the biopsy back in Wales, so I wasn't as nervous about the thought of surgery, major surgery. So I was glad to be there with Zach, and he filled me with confidence, and I just wanted to get on with it. I can't say I was nervous. I was just really pleased actually to be there so quickly and just getting it done.
And Jim, obviously you weren't having the procedure, but you're still deeply involved. How did you feel on the day?
Well, slightly nervous because it was a general anaesthetic rather than a local anaesthetic because of the location, the cecum at the end of the colon. But overall, not too worried because it was Zach, and he does fill you with confidence. And again, it's a non-invasive procedure, it's not full surgery, which was a relief, really.
How were you in the first few days after the procedure?
Fine. Zach obviously did the procedure. He was there not long after I woke up and said it had all gone well. A little larger than he thought because it had grown since the original scan. And it was in an awkward spot, very close to the valve leading into my small intestine. So he said it would have caused a problem soon. So again, speed was excellent. He was fairly confident it was a benign growth and he'd removed it all. So good to go. So I was absolutely delighted.
Could you describe your recovery to us? What was it like in the days originally, sort of post-operative?
I mean, you don't actually feel any pain. It's all done. A little glass of Bovril, I think, in the night, and some soft food the next day. But you just feel as right as rain. You know, a little bit sleepy after anaesthetic, but that's obviously what you'd expect. And good to go home, really. The job is done. I asked, could I eat anything I should be restricted on? So it was soft food for one day, and then basically, have what you want. So, excellent, back and making my grandson's birthday cake the night I got home.
Wow. And Jim, how great was it for you to see this bounce back so quickly after the operation?
Oh, it was amazing to see the speed of recovery, as I mentioned, and I had looked into the full resection option and what's involved in terms of the length of time it takes to recover, dietary restrictions and so on. So the speed of recovery with use of Speedboat was just incredible, really.
What does it mean to you to know, looking back now, that you've actually managed to avoid having surgery where that was potentially on the cards for you?
I mean, it's just great, you know, because it's always a worry, isn't it, if you have surgery and you have stitches and you have everything, it's more of a concern. Obviously, the recovery time is longer, and we did find out that there'd be a lot of restrictions on eating, whereas, as I say, there was no pain, there was no real recovery at all. I was just fine, and you just carry on. The other option that I was given of the surgery, obviously there are more risks with full surgery. The recovery time is much longer. I didn't want to leave the family for too long because, as I say, we're quite busy and quite involved. So overall, it was just great.
What advice would you give to somebody else facing a similar diagnosis or similar condition?
I mean, I would like to tell people about it because I wouldn't have known about it, which is, we did mention it to the consultant, but he vaguely had heard about it, but not enough to recommend it. The same with my GP. She didn't know anything about it at all and said it's probably best to go for surgery. But I'd already made up my mind to go with this. So it would be great if people knew that this is so straightforward and your recovery time is so rapid and you can just get on with your life.
And obviously you had to travel because this wasn't available to you locally. Is it an advantage, you think, to be able to have a service like this offered locally to you?
Yes, of course. I mean, we went because that was what was on offer, but it would have been easier. Jim had to drive me there and back several times. I mean, not a problem because I was so glad that it was done, but it would have been nice to, you know, for people to know about it and for it to be a local thing. I mean, everywhere people need to know. It's very straightforward. And because basically not having any recovery pain, I mean, you just don't feel anything. You wake up and you're fine. which is amazing.
Having been through it and seen how quick the procedure is, and comparing that to full surgery, it seems a no-brainer. And if I was talking to anyone about growths in the colon, the lesions, then I would definitely recommend it and make sure people did know about this as an option, because it is so much better than full surgery.
Since your operation, we've now have this available in Wales, so that would be more in your locality. Would you see that as an advantage to people?
Oh, definitely, especially if GPs and local consultants are made aware that this is an option. You know, it would be a great benefit for people locally. We did have to travel, well worth it, but we did have to travel. But to have the option locally, for example, if Jim ever needed anything, you know, or anybody I knew, I mean, I would just say, go for this, because yeah, it was great, and Dr. Zach was amazing.